Hi, Shiva. This is Rachel, the physical therapist from the seating clinic at University of Pittsburgh. How's it going today?
I'm doing well, thank you, Rachel. How are you?
Doing pretty well myself. So this is just a reminder, you spoke with our scheduler, but we're just going to go through sort of a screening and talk about if you need to come to see me in person at the seating clinic, or if we could do some telehealth to save you the travel and potential exposure to things. So let's just go through some background questions. If you have any questions or need to stop me, feel
Sure.
free. So just let me know, is there anything that's changed in your medical or functional sort of background? You know, you have an incomplete spinal cord injury, and the last time I saw you were walking with a cane, and we got you a scooter to sort of use when you were tired. Is anything else changed in your medical status or anything that's sort of related to how you get around?
No, no real changes actually. No.
Okay. And you've had some ongoing pain in your back and your legs. Is that sort of still ongoing? And how are you doing with a scooter related to your pain?
Um, the scooter is difficult to manage, to be honest with you. Um, I have to sit bolt upright in a scooter, and there's not much back support to it either. So, and because there's no suspension in the scooter as I'm navigating even just outside my home to school, then I'm feeling every tiny little bump in the road, and it's just aggravating the back pain even further.
Yeah, that makes sense. I think when we got the scooter, you weren't really using it as much. But if you're definitely using it on the bus or to get to school, you're going to feel every little bump. We'll come back to the scooter a little bit, but I'm just going to keep going with some background questions. So you were living in an apartment with an elevator before. Is that still where you're living, or have you
That's
moved?
correct. Yeah.
Okay. So you still able to do sort of your own care for yourself, like getting dressed and bathing, but just ongoing issues with getting about. Is that still the case?
Yes, I'm pretty much independent.
Okay, good. How much are you using the scooter? Are you sort of using it a couple hours a day or using it most of the day?
I'm trying to use it most of the day because I'm becoming more reliant on it. The problem is inside the home at the moment, I can't actually get into the bathroom because the joystick is in the way. So I can't just drive straight in. So I'm having a bit of challenges with that.
Yeah, that makes sense for sure. Um, so just some other background things before we really get into detail about the scooter. Have you had any falls in the last few months?
I probably had at least one fall.
Okay. And when you fell, did you injure yourself? Um, Specifically, did you
No, it
injure enough
was
that you had to go to the emergency room? Nothing like
no,
that.
nothing.
Okay. And no new issues with your skin or anything like that?
No new issues.
Okay. And everything else sort of pretty stable. You're breathing and all that sort of, breathing and heart rate and that sort of thing as far as you know. It looks like you get
Uh,
sort of regular medical follow-ups.
yeah, I have regular medical follow-ups. The only heart issue I have is SVT, and that's about it.
Okay. So I'm going to ask you some questions about the
Mhm.
scooter specifically, and then you can just let me know, respond to the question, and add anything that you feel is relevant.
Sure.
So, have you had any repairs on your scooter recently?
Not recently, no.
Okay. I can see that you got new batteries a couple years ago, but nothing else major going on, huh?
Yeah, nothing else major.
Okay. So I'm going to ask you some questions, and then I just want you to give me a response. Either you completely disagree with the statement, so that would be a score of 1, or you completely agree, and that would be a score of 6. And I can remind you that if if you need it going through. So your
Sure.
current, your means of mobility, meaning your scooter, allows you to carry out your daily routine independently, safely, and efficiently. So on a scale of 1 to 6, what do you think about that?
Um, Using my scooter, I would say about 4.
Okay. And what about your scooter meeting your comfort needs?
Oh, I would say that about two, because of
Okay,
the amount of
that's
time it's
definitely
walking.
not comfortable. Okay.
Yeah.
What about meeting your health needs? So it's not causing pressure sores or issues with breathing. Is there anything else that it's affecting your medical needs?
No.
Okay. So that one you would say you'd completely agree that that's doing okay.
Yeah, it's doing okay.
What about being able to operate it independently and safely? You're still doing okay with that?
Uh, yes, I can operate it
Okay.
independently. Yeah.
Okay. What about being able to reach or carry things like within your apartment, like being able to get to a table or a counter?
I can get to a table-ish, but I can't get underneath it, or you know, I could navigate towards it, but I can't do anything else because the scooter is like the handle is all in the way.
It's in the way, right? So on that 1 to 6 scale, where do you think that one is?
Probably a one.
Okay. Okay. What about doing transfers, like getting in and out of bed or off a couch or a chair to the scooter?
Well, I'm kind of restricted in the scooter of how I can transfer in and out. If I put too much weight on one side, it's kind of tippy a little bit as I try and get out. So I would say that about two.
Okay. Sounds like you might be using your arms and pushing on the chair a little more than the last time I saw you. Um, so what about carrying out your personal care tasks like getting dressed or eating?
Um, yeah, I can eat just fine in this scooter. It's just getting to in and around the kitchen.
Right.
It's just impossible to navigate through it.
Okay.
Getting dressed, I can't use the scooter for that.
Okay.
Um,
And what, so getting around indoors, that sort of leads to the next question. So that, yeah, the next one is that your means of mobility allows you to get around indoors. Um, that sounds like you
that's
don't
a
don't completely
struggle.
agree there.
That is a struggle for sure. Can navigate two things to a bit, but I can't get anything close to anything
Okay.
because
Yeah. Okay. And what about getting around outdoors?
getting around outdoors, well, if it has enough power to get through those potholes, yeah, but then it just causes so much pain to get through those potholes. So
Yeah. So in that 1 to 6, sounds like you're
uh,
on the lower end.
yeah, definitely on the wall that, yeah, I'd rate that as about two.
Okay. And what about using transportation? You use a bus, if I'm remembering.
That's
Um,
correct. Yeah.
yeah. So what your current scooter, how does it allow you to get around on the bus?
Well, normally it's an absolute struggle to actually navigate up the ramp and through into that bus, because if I had the slightest bit of weather issues, whether it's rain or snow, I'd be lucky if my scooter can actually get up that ramp in the first place. And then in any sort of condition, navigating around that corner within the bus takes forever. I'm doing like a 5 point turn, and everyone's kind of staring at me and waiting for me to actually park up.
Okay. So yeah, it sounds like that's not ideal either.
Nope.
So it's sounding to me like the scooter's really just not meeting your needs anymore, and something more like a power chair would be more appropriate. Is that sounding like what you were thinking
That
for
would be
our next
lovely.
appointment?
Yeah.
Okay. So there are some different options for power chairs, and we can bring some things for you to try if we're going to do telehealth or if we're going to see you in person. But the things to think about are I really think it sounds like you need some seat functions, which means that the seat could change positions. It could tilt back, it could elevate your legs. I think that sounds like it really could help out with your transfers and your positioning for your back pain.
Well, that would be lovely. I've got because I've got rods in my vertebra, so putting vertical pressure um, through my spine causes a lot of pain. So if I'm able to tilt back, that would relieve a lot of pressure from my back. That would be great.
Yeah. And that I think that's something we should certainly try. And then the other things, there's lots of different components that we can change, but The biggest thing to think about is the base. And then again, we can try that, but there's one that's got the bigger wheels, the drive wheels in the front, or the drive wheels in the middle. You know, there's some pros and cons to that, but given the terrain where you live and getting on and off the bus, the front wheel drive might do better for you. It's just something we need to think about in your apartment. Is it going to fit making the turn? Sometimes they take turns a little wider, or it can't turn in its own space, so to speak. So that might be something that we should consider, the front wheel drive. And then if it doesn't work in your environment, the mid wheel drive is still a good option. It just maybe is not going to do quite as well on like steeper, the ramp, or the slick unevenness of the ramp. But we can think about things like that when we see you for your actual appointment.
Okay.
So it does sound like what most of your needs are. We could probably meet doing a telehealth appointment. And since you're so far away, and it's hard for you to ride in the car or on a van for very long, that seems like a good way to go. And then we could always pivot if things don't go well and have you come in. What do you think of that option?
That sounds great, but that would work. Yeah.
Okay, so you work with Carl at ABC Medical, so we'll coordinate a time when Carl and I and you are all available, and we'll have Carl come out to your apartment with some power chair options, and then he'll get me on a video call with our health systems approved video call options, and then we'll sort of go through looking at what's going to work for you in your apartment, and then when you go out to go to school and things like that.
Okay, that sounds great.
Okay, great. So we'll be in touch once we've arranged the schedule. And like I said, then Carl will see you in person soon, and I'll see you on the computer soon. Okay?
Okay, that sounds good. Thank you very much.
Yeah, great. Thanks so much, Shiva. We'll see you soon.
See you soon.
All right.